A 33-year-old Caucasian female presents to your clinic after finding a lump in her left breast during a self-breast exam. Family history reveals that her grandmother suffered from ovarian cancer at age 37, and her mother died from breast cancer at 36 years old. Biopsy of the breast lump is performed, and the pathology report indicates that it is cancerous. What type of mutation did this patient most likely inherit? DNA repair. DNA repair. Hereditary breast cancer is associated with BCRA1 and BCRA2, both of which are DNA repair genes.